Blood pressure is cardiac output times by systemic vascular resistance. The thing we really care about is cardiac output and flow of blood to the tissues, but that's difficult to measure, so we measure blood pressure as a surrogate. But the presence of this term confuses things in specific scenarios, like major hemorrhage. The heart relies on venous return to fill up to then pump it to the rest of the body. If you drop your venous return, your cardiac output will drop. For example, in major hemorrhage, if all the blood is on the floor, very little of it is returning to the heart and the heart's cardiac output drops, so your delivery of oxygen to the tissues also drops. But what also happens in trauma is you get a huge sympathetic surge and you get lots of adrenaline and noradrenaline being released, which causes an increase in heart rate and vasoconstriction, which massively increases your systemic vascular resistance and may give you a normal looking blood pressure, even though the cardiac output is low. So the blood pressure in a fit young trauma patient can be very deceptive, because while numbers like 115/70 may look completely normal, they might have lost liters of blood and are only maintaining this blood pressure because they are so vasoconstricted, their resistance is really, really high. These patients are better monitored using their lactate on their blood gas and their base excess, because these will give you an idea of how well they're actually sending oxygen to their organs that matter.